All right, good afternoon, everybody. Hope you had a good weekend. Yesterday afternoon was a nice surprise. Here with Josh and Paul and a special guest I get a chance to introduce in a minute. But first, let me give you, 3 days of COVID-related numbers. A lot of COVID cases, a lot of tests reported. I think that's worth pausing on just for a minute. I mean, people tell me Rhode Island is on fire. They have more COVID cases per capita than almost anywhere else. Yes, but they also test much more than almost anywhere else. So that is related to those numbers. I think much more interesting to me continues to be the positivity rate. Ours is down just a titch over 6% right now. That's interesting. We've been trending down just a little bit over the last few days. Last week, our 7-day average was 7%. Now it's, I think, 6.8%. You can't jump too much from those numbers. I don't know if we're bending the curve, but at least we're trying to flatten it a little bit. But the next 2 weeks will tell us a lot. Positivity rate is an early indicator for hospitalizations. That's 33 hospitalizations. You'd think, okay, that's 11 a day for the last 3 days, which is what these numbers are. But remember, Friday, they were flat. And Saturday, they were down 34. And Sunday, they were up 67. So it gives you an idea of the mountain range as those numbers fluctuate. Josh reminds me, probably most relevant, because we look a lot at hospitalizations, is the fact that we had about 1,200 hospitalizations 10 days ago. So we're a little more than that right now, but it's something we've got a close eye on. It's something that seems to be, for now, under control. It's something we have some control over. If the hospitals decide they're getting closer to capacity, they can throttle down on the electives. They're doing some of that on a voluntary basis. Some of our other states are doing that more aggressively. Like a few days ago, we've got our beds are 75% occupied. Our ICUs, the intensive care, are 59%. Less than half of that is related to COVID. Just gives you an idea of where we're going and the fact that the capacity is sort of stable over the last week or so. The next slide is good news, I think, in terms of the vaccine. And here it comes. And I was at Hartford Hospital today, where I think one of the very first people in the United States got the vaccine. 1,950 delivered to Hartford Hospital, 19 different numbers delivered to different hospitals, 12 different hospitals there. Paul wanted me to remind people, if they looked at the map and they say, hey, how come there's nothing near my region? At least those blue dots are where other affiliated hospitals are. So you can see all the different places that the vaccines are being delivered this week. That in addition to the nursing homes. You can see exactly where the vaccine order and delivery is. The hospitals, 15,600. And the nursing homes, 15,600 this week. Middlesex and Hartford were the first two hospitals that got it today. The rest of the hospitals get it tomorrow and the next day. Here come the nursing homes. Week 2, the numbers ramp up a little bit. One reason is Moderna joins Pfizer. And so we'll have about 129,000 vaccines by the end of next week. It's worth remembering that that number is going to continue to ramp up. We'll have about 500,000 vaccines by the end of January. Sort of each, you have to get 2 injections before you're fully vaccinated. So that means most of our first-line responders, those in Tier 1, will have first and second vaccines administered by the end of the month. And then probably by the end of March, we'll have about 1 million people who've been vaccinated, not once, but twice. And those move into 1B. Those include the first-line responders beyond healthcare in the nursing homes. So this is where I was this morning, and more importantly, this is where the first 15 people got their vaccination here in the state, and one of the first in the country. I've got somebody I've gotten to know very well, Dr. Keith Grant. You can see here he's getting his vaccine. He was just edged out by his mate, Dr. Kumar, at Hartford Hospital. But Keith Grant is important. He's an Air Force vet where he was a nurse. He is a leader in infectious diseases, infections at Hartford Hospital. And he was a senior member of our vaccine advisory group and on the scientific committee. And that's important because not only has the FDA now approved emergency use authorization for Pfizer, so has Britain and their related agency. They have tens of thousands, over 100,000 people who have already been vaccinated with this, as has Canada, which has started vaccinations as well, and as has our scientific committee, including Dr. Grant. So we said, well, you believe it? Let's get vaccinated. And I got to tell you, he and a lot of his mates there at Hartford Hospital were lined up for the opportunity to be vaccinated, be safe, and lead by example. Dr. Grant, thank you for joining us.
Hey, thank you, sir.
What do you have to say?
Well, I mean, it was a absolutely great moment for science, for the healthcare community. It's a great moment for the state of Connecticut, and it's a great moment for you and your team who have helped us, the healthcare system, exponentially to ensure that not just the vaccine is here now and ready for administration, but in our quest to ensure that appropriate PPE, there's collaboration with testing. So a lot of work has gotten us to this point. But, being a part of the scientific advisory group, great honor of being with such, great minds. I think the accumulating event of today of getting the vaccine is, we do believe in what we've said about the science behind this and the safety and efficacy of this, and we strongly believe in it. And for a member of the team, and I'm sure every member on that team who has advised that we should go ahead with the vaccine, will move forward in getting the vaccine in due time. But this is big, significant news for the healthcare community. It's a significant news for every member in the state of Connecticut. It's a significant step for us to move forward to, what we remember of normal in this great state of Connecticut and in this great country.
Thank you. Keith is sticking around for your questions, as are Josh and Paul.
Channel 3 Eyewitness News.
Yes, I guess, my first question will be for Dr. Grant. It's been a few hours since you first got this vaccine. Can you share what you're experiencing in terms of any short-term minor side effects? We just want to give people the opportunity to kind of know what to expect.
Yes, and, no side effects at this point in time, which is expected if you really look through that study. Some mild soreness at the site of injection, which is expected with every shot or any shot. So absolutely no side effect. I feel great, and definitely that's a question that I've been getting a lot at. I think there's a lot of people who are like watching a timeline now, so they'll check in every now and then with me and say, hey, how are you feeling? So the good news is, I think, a lot of people, when you look at studies across the country, a lot of people, when asked, will you get the vaccine right away? The number right now, I think, is about 45% of people says absolutely yes. And when you change that question to, will you get the vaccine at some point afterwards? I think a lot of people are trying to see and staying out to see exactly what happens to the first set of people. But I think us, as the science and leaders in this group, we have an obligation to step forward. I think that's what we did today.
And that's great that you're feeling well, doctor. And, question for the panel, talking about the vaccine confidence, do you foresee a point where we're going to have more vaccine than people willing or wanting to take it?
If you look at, if you just look at Pfizer, so Pfizer's intent is to be at 1.5 billion vaccine within the next 16 to 18 months. And if you look at the general survey across the country, as I stated before, there's still some people who will most likely wait for a while to get it. I think the pure economics of it, I think supply for a point will outpace demand, and it will even out. I hope we get to a point when we have way more vaccine than we actually need. But at this point in time, the ones that we have is allocated in the appropriate group. I think Tier 1A, working with the nursing homes and our critical care providers, we'll get to that. But, those are concerns at some point we might have. And I think, Governor Lamont working with the healthcare institutions across the state and our citizens, we'll figure that piece out.
And Governor, I mean, based on the internal polling that you guys are doing right now, when it comes to the confidence, do you foresee a point where we're going to have more of the vaccine than people wanting to take it?
Yeah, as people have more Dr. Grants and friends who have taken the vaccine see that they do it with confidence, knowing that it keeps them safe, you'll have more people coming forward. And at the same time, we're going to have, we're ramping up the production of the vaccine, especially when you add on Moderna starting next week. So my hunch is that demand will outstrip supply for the next 3 or 4 months. Then that may shift as we move into late spring, summer.
All right, and the final one for me, logistically, now that we're looking back on it, how did the rollout go? And do you foresee any challenges when more doses, when we have the AstraZeneca, when the Moderna one comes out? Are there going to be challenges when more shipments start to go out?
I'm sure there'll be challenges. I'm sure there'll be dry ice issues. But so far, day one, and the preparation for this over the last couple of weeks has been pretty effective. I think I, as a governor, am happy with the support we've gotten from the federal government and the CDC, the fact that they're purchasing the vaccine, the fact that they're working with the big pharma to get this distributed. We've got the pharmacy companies who are doing a lot of the injection work. So I think so far, so good.
News 8.
Now that you have the vaccine rolling into Connecticut, describe the safeguards that are in place. A truck drops below minus 90. How do you know? How do you know that you're getting a vaccine that's working? What kind of safeguards are in place?
You want to take that, Josh? Or Dr. Grant, perhaps you're close on this.
Yeah, so, that's a good question. So the CDC has put significant efforts in place to ensure that when the vaccines are transported, the means by which they're transported, the containers that they're transported in, maintain the temperature required. Also, this morning when we opened the first box, there's a monitor system that's on there that tells whether or not it's maintaining that. So to answer your question, how do I know or how do we know that this vaccine have maintained temperature throughout? The CDC and Pfizer in their packaging has sent an actual equipment over that tells whether or not it maintained temperature.
All right, and with the big snowstorm coming, I know this probably won't affect anything now, but down the road, more storms trying to get the second dose here. How much window do you have for that second dose? It says 21 days to how far in case there are more problems?
So 21 days that's the number that we're going for. So we're absolutely going to be administering the 21 days in the second dose. For us, the healthcare providers that will be getting this is a very resilient group. This is a timeline that, especially in these first few administration, we're going to ensure that we meet. So if we have to go over a day or two, if you look at the studies, the efficacy might not be affected as much, but we're committed to the 21 days at this point in time.
I hope they're working around the weather to answer your question. I mean, as you know, it's big flights coming out of Kalamazoo, Michigan. Federal Express has got the western side of the country. UPS, I think, has got the eastern side of the country coming to distribution, arriving by trucks. Right now, I think they're planning this, and I hope they're planning around the weather as well.
Governor, for you, when do you expect to take it?
Yeah, everybody's asking me that. I'm of two minds. I think I'd like to be with Dr. Grant and take it and lead by example and say I think it's safe, I think it's effective, I think it's the right thing to do. But the other half of me says maybe I should wait to Group 1B, which is what my category is. So I think I'll let the CDC help me with that decision.
Thank you. Good luck.
NBC Connecticut.
Good afternoon. We're seeing that frontline workers are being scheduled for their vaccine through the various hospital systems that they work for throughout the state. But what about those who work in independent offices and they don't actually work in a hospital, those general practice doctors, pediatricians, who are still having work-related exposures potentially? What is the state's plan to give them access to this vaccine?
You know that, Josh or Dr. Grant?
So the state has a very, very good program in place to ensure that, there's a number of meetings. Today we had 2 meetings. and is to work with different entities across the state in order to deliver the vaccinations as efficiently and effectively as possible. For healthcare institutions or for standalone institutions, there will be some collaborative efforts between healthcare systems and those institutions, and there will be identified areas where individuals, healthcare providers will go administer and get administered vaccine.
Do you know how many people were vaccinated today across the state?
Oh, across the state? I'm not sure across the state. Within our system, 15, 20.
Paul or Josh, do you have an answer for that? Do we know?
We may put out we're going to try to figure out if we can collect a final count for the day, and we'll probably get that out via the governor's social media either tonight or tomorrow.
Okay, and are you expecting weather to interrupt distribution later today or later this week?
In terms of weather playing a role in distribution of the vaccines, is that the question, Kristen?
Yeah, do you expect the weather to interrupt the distribution when it comes in, that storm?
No, I don't think we expect that the current storm this week or winter weather to play an effect on the overall distribution plan put forth by the state of Connecticut, working with our medical partners. This is a great opportunity for me to talk about the great work of our Connecticut Department of Transportation, who have been ready and willing to clear the roads when storms come about, and I know they're ready for this first storm as well.
Okay, and then lastly, Governor, this question is for you. You said last week CARES money is going to be prioritized towards health care. There was another rally today by those who work in the restaurant industry begging for relief from the state. Did that change your mind at all? Can we see any relief coming their way?
Well, first of all, they are open and operating, and that's a big step. In terms of additional relief, believe me, I'm looking at it and seeing what we can do out of the last of our CARES Act money to provide a little bit of support for the restaurants who are struggling.
Thank you.
Fox 61.
Governor, actually, to build off of that last question, do you feel that this vaccine can help rebuild our local economy and consumer confidence?
The answer to that is yes, but it's not a silver bullet. It's not going to happen in the next 2 weeks. But I'd like to think come this spring, where you have a substantial number of people who've been vaccinated, 1 million people vaccinated twice, come March, I think people are going to build confidence. We'll get our economy moving again. In the meantime, we've got to be cautious. But as you know, we've got, well over 95% of our economy is open. And to your point, it's about confidence in terms of people wanting to go out. I think it's going to take a little bit longer, and they're probably erring on the side of caution, which is good.
With today being such a monumental day, even Hartford Hospital saying it's, almost like putting a man on the moon, how do you feel that this might be the beginning of the end?
I think you said it well. I said today when I was at Hartford Hospital that I'm a football fan, and I think I can see the end zone. But I also know that there's an awful lot of blocking and tackling we got to do between here and the final 30 yards. I know this is a time where we got the festivities and the holidays and the family. We don't need another surge like we had a bit after Thanksgiving. So I want to temper my optimism with a note of caution. Be careful a little bit longer, then we'll get out of it a little bit faster.
Lastly, I know you believe that you'll have about 1 million people vaccinated by March. When do you believe the general public may begin to start receiving this vaccine?
I think soon thereafter, let's say late April, May, you'll have wider distribution. This depends upon the supply chain and making sure that Moderna and Pfizer, we'll see, maybe AstraZeneca joins the parade as well, in which case we could ramp things up even sooner.
Okay, thank you.
News 12 Connecticut. WTIC 1080 News.
Hi, Dr. Grant. How confident are you, the question was actually, inside the hospital with the training, handling the deep freeze vaccine and sort of bringing it to life, how many hours did that take to get people up to speed on that?
I think so. Your question is about how do we train our colleagues in order to reconstitute and administer the vaccine?
Yeah.
Yeah. So, I mean, the administration process itself is like any other vaccine. I mean, there's a lot of, it's very nervy at this point in time. We had a lot of discussion even before going into this. This is, as stated before, this is a monumentous occasion for us from a science perspective, from a clinical medical perspective as well. So obviously a lot of nerves, but theoretically, when you think about it, it's just like administering any other vaccine. The reconstitution itself, again, it's a part of the normal clinical process. There's some medication that needs to be reconstituted, and our pharmacist was there with us today to take that leap and get that done for us.
Thank you.
Connecticut Public Media.
Good afternoon. When do you think we will see the vaccine working in terms of bringing the positivity rate down if we are currently in the holiday season where we might see a spike? So I think originally it was suggested 2 weeks within the vaccine distribution, but if that falls in line with the holidays, when do you think we'll really get an accurate number of how it's helping the positivity rate?
I think the positivity rate is going to take a few months before you have enough people vaccinated that it makes a difference. But I will tell you that in terms of doctors on the front line and nurses and those at all of our different hospitals being able to stay at work, I think you'll see that the vaccine makes a difference over the course of the next month. In terms of folks in nursing homes being a little less likely to have to go to a hospital, that'll help our capacity in the hospitals as well over a period of time.
The Associated Press.
Thank you, Max. Good afternoon, everyone.
I think Sue muted herself.
Sue Haig, are you there?
How's that? Can you hear me?
You sound
back.
Oh, sorry about that. Good afternoon. What is the plan for distributing the vaccine to the affiliated hospitals that you mentioned?
For us, the plan is as stated initially. So all the hospitals within the Hartford healthcare system will be getting the vaccine. Some hospitals have already gotten the vaccine today. We've allocated across the system. With the, I don't want to say outside providers, with our partners across the state that will be getting vaccinations from us, will take just a little bit longer in order for us to facilitate that process. So I'd say within the end of this week, the beginning of next week, we'll start working with those groups in order to getting them in and getting them vaccinated. So within the next 2 weeks, there's much that will happen. Within this week, we will refine the logistics. But at this point in time, I think we're ready and prepared in order to facilitate all areas, all offices inside and outside Hartford healthcare system.
What about the other hospitals?
And Sue, to pick up on that, in addition to the healthcare systems, the large healthcare systems such as Hartford Healthcare, Yale New Haven, et cetera, who will be helping to support some of those smaller independent groups, as the governor showed in one of his charts. Starting next week, we'll start getting doses out to federally qualified health centers, local health departments, and other providers who will be administering vaccine to healthcare providers in phase 1A, and then will become an increasingly important part of the distribution into phase 1B. And so we've got now over 70 providers in the process of being onboarded by our State Department of Public Health, with a estimation will probably be around 100 providers by the end of the year enrolled in the program and trained and qualified to start administering vaccine.
And thanks for that, but what's the time frame for those other hospitals? Like I saw, like Bacchus Hospital, for example, they weren't on that map. So what happens with them?
Yes, as Keith said, starting next week, all those other healthcare providers will start to get vaccinated.
Okay, I didn't know if they were lumped in that group. And also, if people are in the 1B group, like people that are over 65 or have pre-existing conditions, what should they be doing now? Should they be contacting their general practitioners to maybe get in line for a vaccine, or should they be waiting until a clinic opens up where they live?
So there's no waiting list, if you will. I think the most important thing for people to do between now and when we have more communication about phase 1B is, as the governor said, keep wearing your mask, keep staying in small groups, stay to your family unit, be very careful. As everyone knows, the infection rates out in Connecticut, across the region, across the nation are high right now. So take extra care with the traditional public health guidance. And have a little patience, and we'll get to phase 1B and have more guidance there in the coming weeks.
Okay, thank you.
The Waterbury Republican American. The Waterbury Republican American. The Hartford Current.
Hi, everybody. First of all, I just wanted to clarify something that came up before. What is the timeline for all healthcare workers in the state to have received both doses of the vaccine?
My understanding is we're gunning for the end of January.
Okay, got it. I'm also wondering what the latest data that you guys have on what percentage of healthcare workers are interested in taking the vaccine or planning to take it.
Keith, do you have some current numbers from Hartford Health?
Yeah, so we did a survey, and which is not unlike most healthcare systems. So we did a survey because, obviously we're getting an allotment of vaccines, and we need to ensure that it gets to the critical care area. We also want to ensure that this is not a mandatory process, so we're going to ensure that we identify those folks that are willing and ready to take the vaccine. So we did a survey, and from the survey, about 65% of the healthcare system, medical colleagues, to include our custodial staff or security or food delivery personnel, people that are working in the kitchen. About 65% of this group is willing to take the vaccine at this point in time. Again, if you look at studies across the country, this is not dissimilar. This is a very similar number. There is a number of other data points and other surveys that look at questions such as I spoke as before, would you be willing to take the vaccine like a month after it is out, for example? For a number of reasons, I think people are responding to that, and that's an additional few percentage. So at this point, I'd say safely about between 60-65%.
Got it. And one more question that is maybe for Josh, maybe for Keith. The hospitalization numbers statewide have been kind of hard to figure lately, up a few days, down a few days, up a few days, down a few days, even as cases have continued to increase, and we're trying to figure out what's causing that, if you guys have any theories about why that might be.
So one of the things that we've learned a lot in this, and we've had to learn in this process, so another number you could look at to kind of help to explain this, is the percentage of patients that are COVID positive that are being treated in our critical care at this point relative to that which we were treating in March and April, right? So that's improved quite significantly. So our ability to treat and respond to this disease from our critical care colleagues are doing an exceptional job, have improved quite significantly. People are getting care much earlier as well. So our ability to discharge patients are significantly better. So what you're seeing is a quicker turnaround within the health system. And I think that's what's not skewing the data, but that's one of the outliers within the data as well.
The Connecticut Mirror. The Connecticut Mirror. Hearst, Connecticut Media.
Thanks, Max. Dr. Grant, could you articulate what you and your colleagues are feeling now that you're not playing Russian roulette every time you're dealing with a patient who's ill with COVID? I mean, it's been 9 months. What's the sense of relief?
So the sense of relief, I wouldn't say Russian roulette. So firstly, I'm very confident in the practices and the policies, including the PPE and policies we've implemented to ensure that our healthcare providers in general keep safe. And if you look at the data, not just across Connecticut, but across the country, the antibody studies within healthcare systems are very close to the community, which means even though they're more exposed, they're practicing well and they're protected. So I think I'm more confident because this gives a greater hope of protection, obviously, for healthcare providers. But for example, Governor Lamont speak about the nursing homes being shifted to Tier 1A. What that does, it reduces what is a very vulnerable population with a high mortality rate. I think areas like that has a great impact. In general, in the community and returning, so 95% of our economy is open in the state of Connecticut. But at the same time, it doesn't feel that way. It doesn't feel that social vibrance that Connecticut have. I think that's a potential with this vaccine. Will it contribute to ensuring the healthcare system is safer? I think it will have an impact, but the providers within the healthcare system have done really well in maintaining compliance with mask wearing and other such things to ensure that they're safe.
Thanks. Governor, it's been 18 days since Thanksgiving, so are we over that potential holiday surge area?
I'd like to think we're getting near the end of that. Then we had Black Friday. Now we've coming up with another round of holidays. So, but you did see a little bit of a peak afterwards, not totally unexpected, maybe related to Thanksgiving, also related to college kids flying in and out. So we've still got to buckle up for a little bit longer.
Yeah, with those 81 dead over the weekend.
That's right.
I saw you in the Capitol this morning. You were socially distant with the electors. Joe Biden is the obvious winner. In Connecticut, he won by 20 points, so 4 out of 10 Connecticut people were Trump supporters. What can you say to them now that the election's over?
That the election is over. Now we look forward. Every 4 years we have an election. We get to restart and renew here in the United States of America. It's one of the blessings of our democracy. And since we're talking about vaccinations, one of the very few things that Joe Biden and Donald Trump agree on is the importance of getting vaccinated.
And finally, Governor, I got a reader question. He applied for a small business grant program about a month ago and hasn't heard anything. Is there like a website for them to look at, or that's kind of granular probably for you on a Monday?
Well, you certainly can go to the development website, and right there you can see CDC what they've got available. I can tell you we sent out, I think it was 10,000 grants. Not everybody got a grant, but some of them even came in from out of state, believe it or not. But we get them out of there. We got those grants to people on a very expedited basis.
Oh, so if he hasn't heard by now, he's probably not getting one then.
That would be my instinct, DECD, unless there was some sort of a mix-up and he might want to just contact DECD. But we're taking a look at what we can do to help people out between now and the end of the year.
Thank you.
The Connecticut Mirror.
Thanks, Max. I just wanted to confirm or clarify, rather, something Josh had mentioned, and then I had a question for Dr. Grant. Josh, could you just clarify for me when you expect the local health districts and the FQHCs to start receiving actual vaccination doses?
Should be as soon as next week.
Okay. Dr. Grant, could you tell me, I understand that for the most part, people are supposed to try to get as close to 21 days as possible. We've heard you could take your second dose possibly as late as 28 days later. But if there is somebody who's panicking, thinking they have to brave a winter blizzard or else go through rescheduling and potentially starting the whole process over, what advice do you have for somebody who just is unlucky and the weather just keeps trying to thwart them?
Well, the data that we've seen so far, and multiple times I've heard this question come up, the advice is not to restart the actual process itself. If you go over by a few days, a week or so, then you should be perfectly fine to still receive the second dose. Obviously, the level of efficacy that's been studied, they're very specific, and it was studied with the 21 days. But again, the gap itself, it shouldn't reduce the efficacy that much. So I think that's a very, very good question, especially in a state like Connecticut. I assume, and especially in the wintertime. So this will happen. This could happen. And we probably should do a better job in setting out some Q&As and some information specifically to this. As soon as we get to that area that we're communicating with the public and administering it to the public, we will.
Thank you.
CT News Junkie.
Thanks, Max. Governor, if I understood you correctly, I think you said that you sort of, in the short term, expect the demand for the vaccine to outstrip the supply. If that turns out not the case, and there are fewer people looking to get it, would you, and you have more vaccine, let's say, than you expected, do you think you would reevaluate your timeline, maybe open it up to some folks in the next tier, maybe sooner?
Well, I'm certainly not going to let the vaccine go to waste.
Right.
So the answer to that would be yes. But I have a feeling that every day, like I said before, you're going to see somebody like Dr. Grant. He took the vaccine. There were no side effects. He felt good. He feels safer. And I think that's what it's going to take to get from 60 to 70 to 80 to 90% of the people willing to get this vaccine on a timely basis. I think demand is going to outstrip supply for quite some time.
Okay. And sort of building off Ken's question earlier, what do you take from the Thanksgiving numbers? Are you relieved? Do you think people stayed home, or do you think maybe more people than you had hoped for went out and gathered?
More people than I had hoped for went out and gathered. Look, we're not South Dakota, we're not Idaho. We weren't at 40%, but we went from 1% to 6%. So look, overall, I think Connecticut does it pretty well. Errs on the side of caution. Could we always do better? Yep.
Okay, thank you.
The Day of New London.
Good afternoon. We've been getting a ton of different questions about the vaccine from our readers, so I just wanted to go through a few of them. One jumping off of what Sue had asked earlier. Someone had asked us, where do we watch for the most up-to-date information on the process to get a vaccine appointment for 1B and 1C?
So you can expect a lot of additional information to come out from the governor and his team as details are finalized. So there's nothing to go hunting for just yet for 1B or 1C. We're focused on 1A, and the team at the Department of Public Health and the governor's vaccine advisory board are busy making the plans now to prepare for 1B. So we'll have much more to communicate in the coming weeks, but just sit tight for now.
And then in terms of another question we had gotten was if you can specify the brand of vaccine you receive, if someone wants the Pfizer vaccine versus, AstraZeneca, if that does get approved. So can you just explain a bit more the process of the different levels in which you're deciding which vaccine people get, how much of that, say, comes from the state versus, the hospitals or healthcare providers that are getting the vaccine?
Keep going, Josh.
Yeah, no, it's a fair question. At this point, obviously, everything arriving this week is Pfizer vaccine. Moderna has not received emergency use authorization yet. We expect and hope that may happen by this weekend, kind of following a similar calendar that the Pfizer vaccine followed last weekend. We're expecting for the near term to see the Pfizer vaccine go both to our acute care hospitals as well as to CVS and Walgreens. It does require some extra care with regards to deep freeze capabilities that are required to maintain it over longer periods of time. So we're probably going to be sending out the Moderna vaccine to the federally qualified health centers, some of the smaller hospitals and healthcare providers, just because it's a little bit easier to deal with. You can get it in a normal freezer. As we get further out into time, we'll have more to communicate. I think at this point, we're expecting, in the science subcommittee, Keith can comment on this, but I think the view at this point is that they're essentially equally strong and no real data so far that suggests that certain populations should favor one or the other yet. But I'd let Keith comment further on that.
Yeah, so I agree. I think that's a very, very good question, and logistically, that's there's much in that we're gonna figure out when we actually do have that challenge. In regards to the actual science behind specifically the Moderna and the Pfizer, very close. They're same exact technology. The other data source or the other pharmaceutical companies that are coming out with vaccines very soon, we'll know much more about them when there is more data being released, and we can read and tell and speak more on that. I don't foresee that being an issue though. Logistically, for example, the Moderna vaccine, as stated by Josh, much more easier to manage vaccine. In that, for a storage perspective, it's easier to store per se. But again, one of the challenges that I don't think we have a choice but to get right. We, as the governor says, we have no intention of wasting any vaccine. We have every intention of getting every single healthcare provider, every citizen in Connecticut who wants a vaccine, and if we will ensure that whatever process is in place and such that it facilitates the needs of the community.
And now, in terms of the different vaccines, do you have to get both doses from the same drug manufacturer, or like, what if someone were to get, dose 1 from Pfizer and 2 from Moderna? Can you do that, or?
No, same manufacturer.
And then lastly, looking at, healthcare workers outside of hospitals, what about, for instance, home care workers who take care of elderly patients who may have recently been discharged from a hospital or a nursing facility? Are they eligible in Phase 1A? And if not, when will they kind of fall in the line?
So all healthcare workers, paid and unpaid, are eligible in Phase 1A, and that's per the CDC guidelines.
Thank you.
Well, thank you. I'm getting the signal, and thank you, Dr. Grant. You were very helpful today. We'll get you back in 3 weeks so we can show everybody that you're good and you're 95% safe from the COVID vaccine. That's a note of optimism. I'd like to show you one last slide that's a reminder, Max, of okay. It's remembering Sandy Hook. And this was 8 years ago. And these were 20 young kids who tragically were killed at the hands of gun violence, and 6 amazing educators. Look at their faces. Remember them. I just want to, say that we're doing everything we can when it comes to appropriate and safe and common sense gun safety here in the state of Connecticut. I can tell you that Senators Murphy and Blumenthal and our delegation are doing everything they can. But also in the middle of COVID, the incredible stress, the sense of isolation, the distress we hear when you call 211, just give somebody a call. A lot of people are alone during the holidays, and that's a tough time for people. Give them a call, and remember these kids. Thanks, everybody.